Hi, my name is Valerie Rosenberger, and I'm a physical therapist assistant with Cone Health. I've worked in a variety of clinical settings since 2005, and more recently have been specializing in cancer rehab since 2012. In cancer rehab, we specialize in working with patients at many different times during their treatments. We may even see patients multiple times during their journey, as we can help smooth out the road to their recovery. I want to cover a little bit about what cancer rehab is, because for most of you, this is the first time going through something like this. So you don't know what to expect, and our goal is to help you through it. Some of the most common things that we focus on is helping patients to regain their range of motion, their posture, and their strength after surgery. We also work on leg strength and balance if there's a weakness or neuropathy after chemo. And of course, we treat lymphedema, which we will discuss in this class. We tailor our treatments to each individual patient and their individual needs. Most of our patients have had breast cancer, but we also see patients with other types of cancer. During your recovery, I want to encourage you to please listen to your body. If at some point something doesn't look right or feel right, tell your healthcare provider. It has happened too many times over the years that a patient finally gets to us and makes the comment that they wish they had mentioned their symptoms sooner to their healthcare provider so they could have sought help sooner in their recovery, allowing for a relief of their symptoms sooner. Now that we covered what we do at Cancer Rehab, let's get to talking about lymphedema. What is lymphedema? To better describe this, I think it's easiest if we break the word lymphedema into two parts to help you better understand its meaning. The end of the word edema means an abnormal amount of fluid in a particular area. This is typically not normal and due to some type of trauma, like if you have an ankle sprain. The beginning of the word lymph means the abnormal swelling is found in your lymphatic system. Also, lymphedema is a chronic and progressive condition if left untreated. As you now know, you have a cluster of lymph nodes in each armpit. The lymph nodes are filters for the lymph fluid that moves through your arm and breast on the side that the lymph nodes were removed from. If the lymph nodes that are left can't keep up with keeping the lymph fluid moving, it will begin to back up in the same side, arm, or breast. To help you know exactly where you are susceptible to developing lymphedema, I'm going to explain the lymphatic system in just a bit more detail. First, understand that the lymph vessels that the fluid moves through and gets backed up in when lymphedema starts to develop are super superficial. We're talking directly under your skin. Try right now to touch your upper arm, around your bicep area. Almost as soon as you place your fingers on your arm, you can feel the muscle underneath, right? Well, you've already pressed past the superficial lymph layer. Crazy, huh? The lymph vessels lay on top of the muscle, and that is where the lymphedema will occur. So when we get to the treatment section, understanding how superficial the lymph vessels are will help you to grasp the concept of why the manual lymph drainage is so light. We also know that each armpit has its own cluster of lymph nodes, and so does each inguinal or growing area. So picture your body split up into the 4 quadrants by imagining a line right down the middle of your body, dividing it into right and left sides, and then across the middle like a belt at the level of your belly button or your umbilicus, dividing your body into up and down. Now, the side where your lymph nodes were removed from is the upper quadrant that you are susceptible for developing lymphedema. If your nodes were removed from your right armpit or axilla, your right arm, and any breast tissue, if you didn't have a mastectomy, the side of your trunk, and your upper back is where you could develop lymphedema. As we discuss the upcoming risk reduction habits, take into consideration that I am only speaking of your affected quadrant. What's your risk? Now that we've covered what lymphedema is, and you now know where you are susceptible to developing lymphedema, let's cover what your risk factor is. There are 2 classifications of lymph node removal. The first and most common that we see is a sentinel lymph node biopsy, or SLNB. You'll see that in your chart sometimes. The other is an axillary lymph node dissection, or ALND. Allow me to explain the difference between the two. You have anywhere from around 20 to 30 lymph nodes in each armpit. When you have an SLNB, that means you likely had 7 or less lymph nodes removed. Most studies say that your risk of developing lymphedema runs around 5 to 9% or less than 10%. If you had an ALND, that means you had more than 7 plus lymph nodes removed. That number could be 10, 15, or all of them. Your starting risk here for developing lymphedema is around 25%. We also need to consider the increased risk of lymphedema that radiation may cause to either the breast or the arm. Radiation itself can increase your risk to developing breast lymphedema since the radiation is directed specifically to the breast tissue. The superficial lymph vessels under the skin can become damaged from the effects of radiation. This may be temporary or permanent depending on the extent of the damage to the tissue. Only time will tell. And the time frame you could develop breast lymphedema could be as soon as during radiation or up to many months after, because it will take your body that long to recover. The other way radiation could affect your risk is if your armpit has to be included in the radiation field. If you're not sure about where your radiation field, which is what we consider the area that's being radiated, ends, then ask your radiation tech at your next visit. If you've completed radiation already, you can ask your doctor at your next visit, or of course, you could always just call the radiation oncologist's office as well. You see, the purpose of radiating the lymph nodes would depend on your diagnosis. The staging, progression, and aggressiveness of your specific type of cancer is how they determine how much radiation and where. They don't want to include your armpit in the radiation field because the doctors know it will increase the risk of lymphedema. So if they have to, it's for a good reason. Some signs and symptoms of lymphedema. There are 4 stages of lymphedema. We categorize them from stages 0 to 3. Here's what each one looks like and what you can expect to find if you start to develop it. Stage 0, what will it look like? Well, the initial signs of stage 0 are actually not a scene, but a feeling of achiness or heaviness in your limb. Because it is getting heavy, fluid is starting to build up in either the breast or the arm, causing the feelings of achiness or heaviness. We call this stage 0 because you have a very slight increase in the amount of lymph fluid in your limb, but no visible swelling as of yet. This amount of fluid is so small, it's not even a measurable circumferential difference with a tape measure. It is detectable, though, if you are coming for your every 3-month SOZO screens with us. The SOZO is a machine that uses an electrical current, the amount in a AA battery so you don't feel it, to detect increased fluid when compared to your baseline measurement if we were able to get one from you before surgery. Stage 1. This is when you have spontaneous reversible swelling, most commonly in the lower aspect of your limb, like your hand or your forearm. An example is when you wake up one morning and you see there's a little bit of swelling in your hand or your wrist. You can no longer make out the tendons or the blood vessels in the back of your hand. However, later in the day, the swelling may be gone, hence spontaneously reversible. If you start to develop this stage of swelling, the first thing you do is stop and try to think of what you did in the last 12 to 24 hours that could have possibly caused your lymphatic system to work harder than it's been able to work. Perhaps you were in your garden the day before and you stayed out a lot longer than you had planned, and it was really hot that day, and you were really pulling hard on the weeds. It could be that you just did a little bit too much, and your body is letting you know in the only way that it can. You don't have to stop working out or doing your hobbies like gardening, because you will not hear that advice from a physical therapist to stop working out. But you could try scaling back a bit to gauge your body's reaction again. Perhaps lighter weights next time at the gym or doing less repetitions. If it was gardening, just try not to stay out so long and not doing it in the heat of the day. Those are just a few examples of ways that you could have done something that caused an increase in the swelling. If you make those adjustments and see no further swelling, then congratulations. You listened to your body, figured out what was too much, and made the appropriate adjustments. This is a good example of where I like to encourage my patients that having lymphedema or trying to prevent yourself from getting it is not a life-stopping event. It's just a life-altering one. Now, if the swelling continues despite any changes you've tried, that's when it's time to seek out help from a certified lymphedema therapist like myself. It may be that it's time to start treatment, but we'll discuss treatment options in a few minutes. A few areas that you can look for this swelling is to first compare the backs of your hands. Can you still see the blood vessels and tendons in both? Now, what about your wrist? Can you make out your wrist bone? Is the circumference and shape of both your wrists similar? One other little trick to see if there's any swelling hiding further up into your forearm is to stand in front of a mirror and bend both your elbows so your hands are near touching your shoulders. Now you can see the back of your forearms in the mirror. Did the width of each stay the same, or is your affected side a little bit wider? These are a few ways to see if you can detect any early swelling. Stage 2. In this stage, you start to have spontaneously irreversible swelling in the limb, meaning that it is going away, but less and less. You may also start to notice some tightening of the skin as the tissue is becoming firmer to the touch underneath your skin. This is called fibrosis, and you start seeing it at this stage. If your swelling has gotten to this point and you have yet to seek care, please do so immediately. It will continue to worsen if you don't do anything about it. And I've seen that in patients over the years who were in denial and honestly just didn't want to deal with it or be told they had lymphedema. But I promise you, if you try to ignore it and hope that it will go away, it's actually more likely that it will get worse. Lymphedema does not typically mean you have a cancer recurrence, so don't let that be a fear. It is almost never related to your cancer, but the fact that you had lymph nodes removed. So don't let those fears keep you from seeking help from your healthcare provider. At stage 3, this stage is most commonly seen in the legs and very rarely in the arm. In this stage, you not only are having the fibrosis continuing, but it's becoming more of an issue because now you also start to see skin changes. The swelling no longer goes away at all, and your limb typically has lost its natural shape. If you still haven't sought treatment, please do. We won't be able to get your limb reduced back to its original size at this point because the skin and tissue change